My name is Professor Lou Irving. I'm a respiratory physician at Royal Melbourne and the Peter MacCallum Cancer Institute. Today we're going to talk about lung cancer. Lung cancer is responsible for about 1 in 5 cancer deaths, and there are about 14,000 new lung cancer diagnoses a year. A cell becomes cancerous when it starts to grow of its own accord and isn't under the control of the normal mechanisms in the body. In most cases that occurs because of multiple abnormalities of genes within the cell. The cells that lung cancer arise in are the lining cells of the airways and in some cases of the little air sacs, the alveoli, and there are 300 million of those in our lungs. By far the commonest symptom is a new, persistent, non-resolving cough. And certainly people who have a cough that goes for more than 3 or 4 weeks should see their doctor. The strong suspicion of a lung cancer usually arises because of the finding on a chest X-ray or a CT scan of the chest of a lump. And there may or may not already be spread to other parts of the body. The first step in the pathway, in the journey of lung cancer treatment and support is to obtain a tissue biopsy. And the reason that the biopsy is essential is that there are different types of lung cancer. And also these days, obtaining tissue for molecular analysis allows us in some cases to use targeted treatments that have made a remarkable inroad to the management and survival of lung cancer.
Hi, my name's Beaty. I'm Principal Scientist here in Anatomical Pathology at the Royal Melbourne Hospital. Welcome to our fantastic laboratory. We can do a frozen section on a small portion of tissue, which can give a result quickly to the surgeon if required. If not, this sample is then taken round to our grossing area. This is the most important area where our medical officer will describe the tissue received, will do measurements on the tissue received, and then cut up the tissue as required and place the pieces of tissue into the white cassettes. We place those little white cassettes into our tissue processing machine. It clears the water from the tissue and then impregnates the tissue with wax so it can then go into our laboratory for testing. We place the processed tissue into a mould and embed them in molten wax. From there it creates the block which we use for microtomy. We cut the tissue at 3 microns, so it's a very thin ribbon of tissue. The ribbon section is placed into a water bath, a warm water bath where the tissue expands, and then the scientist is able to grab a glass slide and pick up the section. From there, we would then perform a special stain or our routine stain. This is the area where routine H&E slides have been assessed, and the pathologist will come back and order additional special stains to be performed on the lung tissue, namely immunohistochemistry and molecular stains. Once these are performed, the pathologist reads the slides and then can complete the report.
Hi, my name's Michael Christie. I'm a pathologist at the Royal Melbourne Hospital, and I look after a lot of the lung cancer patients that come through here. After the samples are prepared in the lab, and we have the glass slides with the lung biopsy tissue on it, we can look at that under the microscope and try and make a diagnosis. This particular slide that I have here is of a lung cancer. These cells here, they look different to the normal cells in that they're much bigger and they're quite irregular in their outlines, and they're jumbled on top of each other. So they're just not behaving in the way that normal cells do. There's also increasingly the antibody tests and molecular tests are able to help us predict whether a cancer will be more or less aggressive as well. On any lung cancer, we do 5 or 10 or sometimes even more of those antibody tests. The different antibodies provide different information. Some of them help us determine that it's lung cancer as opposed to some other type of cancer. Some of them predict how aggressive it's going to be, and some of them show what treatment the lung cancer is most likely to respond to.